Mama June. This Alana Thompson's sister is in urgent medical situation. What happened? There is a panic in Mama June Shannon's family as they meet with a crisis when one of her daughters rushed to the hospital. With the arrival of Family Crisis Season 7, some myths are debunked and truths are revealed with utmost risk. Recently, Pumpkin revealed whether her ex, Josh, and her current boyfriend, Darren, are genetically related. Fans are aware that Josh and Darren are cousins, and Pumpkin began an affair with Darren while she was still married to Josh. As the former partners are divorced, she decided to keep her new relationship low-key. Yet, she occasionally flaunted their matching tattoos on social media. The fresh new update from her revealed that Josh's dad brought up Darren, so they are biological brothers. Mama June. Jessica hides engagement from her family. Jessica Shannon had an engagement with her longtime girlfriend, Cheyenne, which Alana and Pumpkin discovered on social media. During the family reunion day on the show, she shivered when June interrogated her about her proposal to Cheyenne. Jessica had booked a cruise to pop the question. Even after the engagement, Jessica kept it under wraps, not sharing any details with her loved ones. Since she told them she wanted to surprise them with it, June and her other daughters refused to accept her clarification. They wondered if Jessica had unattended their phone calls due to the proposal. Her family looked visibly upset, and she later told the camera the actual reason for hiding it was to keep things between her and her lover only. Mama June. Pumpkin hears about Josh's hospitalization. An exclusive Family Crisis episode came to fans, which showed Pumpkin Eford finding herself having an anxiety attack. While the day began smoothly as she checked into her clothing store and talked about Jessica's engagement, she received a call. That distressing phone call pulled her to the hospital quite breathlessly. Josh has reportedly been admitted to the hospital after the truck accident. During the call, he emotionally questioned what happened to the kids while not believing the alarming news was trustworthy. When the show's producers asked her where she was heading, she declared that her estranged partner's truck had wounded him. Online TV streaming services. The shocking incident shook Pumpkin because she had just taken her things and slammed the door in a hurry. She was in her car, with the WETV crew members following her in another vehicle behind her. They covered Honey Boo Boo's older sister speeding up her car. They met at the hospital, making viewers worried as well. The frantic moment worried many fans. Pumpkin and Josh agreed on joint custody for their children in their divorce. When she has their kids, he is free of his parental duties. She said that she works hard while they are around her on the weekends, but finishes her work when they aren't. Stay tuned to TV season and spoilers for further updates. The Thompson-Shannon family is facing renewed concern as news emerges that one of Alana Pumpkin Thompson's sisters is currently in an urgent medical situation. The development, first reported through social media updates and followed up by interviews with family sources, has sent shockwaves through fans of the reality TV family, prompting widespread speculation, support messages, and calls for updates from both the media and the public. Insiders indicate that the sister in question, Lauren Pumpkin's sibling, has experienced a sudden health crisis that required immediate medical attention, while specific details remain partially private due to family wishes for confidentiality. Sources close to the family confirm that the situation is being treated with urgency and seriousness, and that family members are actively involved in supporting the affected sister and coordinating her care. Mama June Shannon, the matriarch of the family, has reportedly been at her daughter's side, providing emotional support, overseeing logistics, and communicating with medical professionals. The family's attention to privacy is understandable given the highly publicized nature of the Thompson-Shannon household, where personal matters are often scrutinized by fans, media outlets, and social media commentators. Observers note that the family has historically navigated crises with both transparency and discretion, balancing public interest with the need to protect personal dignity and emotional well-being. Early reports indicate that the medical situation developed unexpectedly, leading to emergency intervention and a heightened level of concern among immediate family members and close friends. Sources describe the family as united and vigilant, emphasizing that everyone is focused on the sister's health, comfort, and recovery during this critical time. The news has sparked a wave of fan reactions across social media platforms, with followers expressing support. But family sources have requested respect for privacy, emphasizing that speculation can be harmful, inaccurate, and disruptive to the family's focus on care. The situation has drawn attention to the challenges faced by high-profile families when dealing with medical emergencies. The balance between public interest, media coverage, and privacy becomes delicate, with families needing to manage information dissemination carefully while maintaining emotional focus and support for the affected individual. Experts in health communication note that transparency combined with discretion can help families maintain control over narratives, reduce misinformation, and protect the privacy of the patient while still keeping fans informed in a measured way. Sources close to the family emphasize that the sisters' medical team is working diligently, utilizing appropriate interventions, monitoring health status, and ensuring that care is administered effectively. Observers note that the Thompson-Shannon family has a history of navigating personal challenges under public scrutiny, and their approach to this crisis continues that pattern of careful communication and prioritization of well-being. The announcement has prompted widespread media coverage, with outlets emphasizing both concern and compassion, highlighting the human aspects of health crises within celebrity families. Journalists note that the story is less about sensationalism and more about the emotional, medical, and relational impacts on family members during a sudden health emergency. The public discourse has also prompted discussion about support systems, family cohesion, and the role of extended family, friends, and fans in providing encouragement and solidarity in times of medical urgency. Psychologists specializing in family dynamics emphasize that close-knit families, like the Thompsons, often experience both emotional stress and strengthened bonds during health crises, highlighting the importance of communication, presence, and mutual support. Sources indicate that Mama June and other family members have coordinated with medical staff, organized care logistics, and maintained communication channels to ensure that all aspects of the sisters' needs are addressed while respecting medical privacy and professional guidance. The situation has sparked broader conversations among fans regarding the emotional impact of sudden health issues, the significance of family support networks, and the role of public empathy in high-profile families. Many fans have shared personal experiences of supporting loved ones through medical crises, creating a collective space of understanding, solidarity, and emotional resonance. The medical emergency has also provided a lens for examining the emotional resilience of the Thompson-Shannon family. Observers note that while the family is accustomed to public attention, a sudden health crisis presents unique pressures requiring emotional regulation, logistical coordination, and careful navigation of public curiosity. The family's handling of the situation emphasizes empathy, caution, and strategic communication, balancing the need for privacy with the desire to acknowledge concern from fans. The announcement has sparked social media campaigns of support, including hashtags, well wishes, and virtual messages of encouragement. Fans from around the world have expressed solidarity, demonstrating the emotional impact and broad engagement of the Thompson-Shannon audience. The unfolding situation continues to draw media and fan attention, with updates focusing on the sisters' condition, family response, and potential recovery. The family has reiterated requests for privacy, emphasizing that the focus remains on immediate medical care, emotional support, and maintaining a sense of calm during a highly stressful period. A public response highlights broader societal interest in celebrity health news, emotional narratives, and the ways in which fans engage with families they follow. The coverage demonstrates the intersection of empathy, curiosity, and social media influence, where personal health events become shared experiences for audiences. Observers note that the family's approach to communication, acknowledging concern while maintaining boundaries, serves as a model for other high-profile individuals navigating similar crises. The situation also underscores the importance of family cohesion during medical emergencies. Sources indicate that each family member is playing a specific role, whether in logistical coordination, emotional support, or advocacy with medical staff. The collaboration and unity of the family emphasize the relational strength and emotional resilience that can be critical in managing sudden health situations. The story has also prompted reflection on the human side of reality TV family.